Now we are going to have a basic rundown on the ECG interpretation. There, whenever you come across an ECG, there are certain points you need to interpret, and we are going to study about them each one by one. The first thing to look at the ECG is the profile of the patient. There should be a particular name of the patient because there can be so many patients in the ER or ICU. So you need to have a very clear name written on the ECG paper. There should be a date mentioned on which the ECG was done, and one of the very important thing is to also write down the time at which the ECG was done, because timing is important. For example, in acute coronary syndrome or in cases of the arrhythmias, when you are managing these cases, you need to have multiple ECGs within, like, say, 1 hour, 2 hour, or 3 hours, or in the same day. So it is always important to have the time written on the ECG, so that you are able to actually know at which time certain treatment was given and at which time a certain ECG was done. Also, you need to have the MR number of the patient on the ECG, because sometimes you have two or three patients who can simultaneously have the same name. So in that case, the medical record number or the patient number would help to distinguish which patient this ECG belongs to. For example, in this patient, the name of the patient is Bashir, and this ECG was done on the 16th of the January at 1655 hours. This is also an imprinted date and time, but if it is not imprinted, and if there is no time mentioned from the machine, you can also do it by yourself. And there should be MR number, like this patient's MR number is 007. So this helps us to actually have a basic profile of the patient, so that you can make a difference to which patient this particular ECG belongs to. So in any ECG interpretation, the one very important factor is to go for the patient profile. After profile, the next thing which we should look at the ECG paper is the standard ECG machine settings. There are two things which we are to look at from point of view of the standard setting of the ECG machine. One is the paper speed, which means which is actually 25 millimeter per second. There are options of 12.5 millimeter per second. There is another option of 50 millimeter per second, but the standard paper speed of the ECG machine should be 25 millimeter per second. There is a huge significance of knowing what it actually this is, what can be other options, where we can apply the other options, and why we need to have this standard speed of 25 millimeter per second. And obviously it demands a lot of interpretation, which can be covered in any other video. But from starter point of view, this is very important, very important to look at the speed of the standard speed of the ECG paper, which should always be 25 millimeter per second. Just to give a glimpse of it, in 1 second, 25 millimeter or 5 large boxes or 25 small boxes should come out of the ECG machine. This much paper should come out in 1 second. This is a standard speed. Along with the standard speed, there is also standard voltage of the machine, which is 10 millimeter per millivolt. For the starter, the only thing which needs to be remembered, one voltage of the current generates or creates a height of two large boxes or 10 millimeter or 10 small boxes. It also can be interpreted in another video, but for the starter, the only thing to be known or to be remembered is the standard voltage of the ECG machine is 10 millimeter per millivolt. There are other options like 5 millimeter per millivolt. There are options of 20 millimeter per millivolt, but the standard voltage setting is 10 millimeter per millivolt. There are certain situations where we can actually either decrease or increase the sensitivity of the machine, but that can be explained in any other video. For example, if we look at this paper, we see here on the right side, this is 25 millimeter per millivolt. This is it's mentioned segment, but this is not segment. This is actually second, 25 millimeter per second. This is the standard speed of the ECG paper. This is not the segment. It should be second, 25 millimeter per second, and the voltage is 10 millimeter per millivolt. 1 millivolt would create a height of two large boxes. This is also the same thing. These two large boxes. This is the voltage of the ECG paper or ECG machine, and you should look for it. It should be the standard. It should be the speed of 25 millimeter per second and voltage of 10 millimeter per millivolt. This is very, very, very important to look for the at the patient profile. Name of the patient, date it was taken, time it was done, and MR number. And second thing to actually be careful about is the standard voltage and standard speed setting. So once we are done with the profile and standard setting of the ECG paper, the first thing we are to actually do on the ECG paper is to calculate the rate of the heart beatings. There are it has already I have already mentioned in a separate video in detail about how to calculate the heart rate, but just to have a rundown, there are four ways you can count the number of large boxes between two R waves, and then you can divide 300 by that number. There is another method of counting the number of small boxes between two R waves, and then 1500 can be divided on that number. There is a cramming or offhand way or easy way of knowing the heart rate by actually remembering 300, 150, 175, 60, 50, 43, 37. Then you can find an R wave which is right on top of a thick line, and then you can find the other R wave which is on the right side of the that reference R wave, and then you can drop this formula on the heavy lines like 300, 150, 100. Then you can find out the heart rate of the patient using the ECG paper. The last method of knowing the heart rate is to actually first identify a 6-second strip on the ECG, and then you can count the number of R wave in that 6-second strip, and then you can multiply those number of the R waves with the 10. This last method is very useful in cases of the atrial fibrillation and in cases of the complete heart block. So the first thing, while practically actually interpreting or explaining an ECG of the patient, is to count the heart rate. And at this time you need to know that why you want to know the heart rate, because you want to actually make a difference whether the patient is have a normal heart rate of 60 to 90 or 60 to 100 beats per minute, or bradycardia. Bradycardia means slower heart rate less than 60 beats per minute, or tachycardia. Tachycardia means a heart rate of more than 100 beats per minute. In this patient, actually, we can count number of large boxes between the two R waves, 1, 2, and 3. Then we can divide 300 by this number, the heart rate is 100. We can also count the number of small boxes between two R waves, which is 15, and we can divide 1500 by 15, heart rate again is 100. We can actually find out an R wave which is right on top of a thick line. For example, we can take this R wave, then this is known as reference R wave. There should be an other R wave which is on the right side of this reference R wave, and it needs not to be on the heavy lines like this one. And we can actually spare this heavy line, and along the next R wave we will apply that formula: 300, 150, 100. This is falling short of the 100, so the heart rate is this is 75. So the heart rate is around here, heart rate falls around like 90 or 95. Why there is a difference of 100 and 95? Because this is sinus arrhythmia. Sometime during inspiration and expiration you have a variability of the heart rate, while when you are to the last method can be applied. This is a 6-second strip. You can make these dots. 1 second is actually, this has already been explained in detail in other video. 1 second is actually equal to 5 large boxes or 25 small boxes, and you can count 1 second, 2 second, 3 second, 4 second, 5 second, and 6 second. You can actually identify a 6-second strip. Then you can count the number of R waves in that 6-second strip: 1, 2, 3, 4, 5, 6, 7, 8, 9, almost 9, 10. And you can then multiply this 10 with 10, the heart rate again goes to around 95 to 100. So you can, this is the last method which is very useful when you are actually dealing a case of atrial fibrillation and complete heart block.